where do you get the eyelash from?
So typically eyelash transplants are taken from the scalp. That's where I like to go. There are surgeons that use other locations, let's say below the belt, to keep it G-rated.
Welcome to the More Than a Pretty Face podcast, where we go more than just skin deep to explore the science of beauty so you can look and feel your best at any age. I'm Dr. Azadeh Shirazi, a board certified dermatologist, and joining me today, I'm so excited to welcome Dr. Alan Bauman, who is a hair restoration expert down in Boca Raton, Florida. Welcome.
Thanks, Dr. Ozzy. It's great to be here with you.
Thank you so much for joining us. So, from what I understand, you are a board certified hair restoration expert and you've done over 33,000 hair transplants. Am I getting that number right?
No, well, I've seen 33,000 hair loss patients in my
Hair loss
25-year
patients.
career, and
Okay.
I've performed over 12,000, nearly 13,000 hair transplants.
Oh, wow. So this is what you do all day. That's your specialty, hair.
Yeah,
How to
100%.
grow hair.
Yeah, 100%. All the time, every day.
Well,
That's what we do for the past, 25 years.
hair is such an important part of our being, of our well-being. And, when we see these patients come in with hair loss, it's such a devastating, phenomenon that happens to them, particularly women. I think men, in a way, they can kind of accept it because we can expect men, thinning. But when women thin, I feel like it's even more, traumatic for them. So, it must feel amazing to be able to give people's confidence back, people that have suffered from hair loss. So tell us a little bit about your approach to hair loss and sort of your evaluation and what you look for when you see somebody come in with hair
Sure,
loss.
sure. Well, I mean, just to spin off on what you were talking about, whether you're a man or a woman, hair can be very important. And sometimes, hair is something you're born with, of course, and it makes us look good and feel great, and it's natural and normal for us to groom ourselves. In fact, I remember from my psychiatry rotation way back in medical school that if you were not taking good care of yourself, you're not taking good care of your fingernails or your hair, and you look unkempt, that was a quick sign of psychosis. So evolutionarily, I think we're
Yeah.
basically hardwired to want to take care of ourselves, whether it be hair or skin or our teeth. We want ourselves to look good and feel good. And I think it's hardwired in our brain. And you're absolutely right. When hair loss does occur, it can be devastating. Uh, of course, as you mentioned, in men, there are socially acceptable options. They can shave their head. If you're Dwayne the Rock Johnson, obviously, and built like that, that's fine. But a lot of men, they don't want to shave their head and grow a goatee and get an earring or a Harley Davidson. They just want their hair back. And so we do treat a lot of men, of course. And as you
Mm-hmm.
mentioned, it can be devastating in women because there's no socially acceptable kind of image or option out there. Sinead O'Connor is like, not a great hair hero, obviously. So, and unfortunately, I think a lot of women don't get enough respect from their local dermatologists and such. Local derm might say, "Oh, well, you've got half your hair left, or you look fine. What's the problem?" But when women start to see shedding and loss of volume, their ponytails starting to shrink, and even more scalp shining through or hairline changes, it can be very devastating. And so, man or woman, young or old, hair is important, and that's why we're here to help treat it. So when patients come into the office, I would say the first thing we do is we listen to them. If it's a woman who's
That's really important. That's
yeah, I
right.
mean,
Yeah.
it's critical. And sometimes, in this day and age of a quick fix, online pharmacy, world that we live in, it's like a bunch of check boxes or multiple
Yes.
choice. And then, somebody sitting on their porch is, giving you a prescription for something without even looking or talking to you. So I'm against that, obviously. What we
Mm-hmm.
like to do is listen to our patients and find out what's happening. We take a detailed medical history, family history of hair loss. Of course, we'll get into the fact that hereditary genetics play a big role, but also lifestyle factors. What are the things that are going on in a person's life that could be either stressing them out, changing their nutritional intake, increasing inflammation, dysregulating the hair follicle? It could be medications that they may have just started, or a new diet program or nutritional regimen. It could be something they're recently diagnosed with, or could be just aging, changes in hormone status over time, and other factors can influence hair. So we want to get that well-rounded approach going, a holistic approach to their hair loss story, and then we examine them. We look at their scalp. And it's not just from across the room to see if it's shiny and thick and full or not, but we actually use AI powered microscopes to do hair density and hair caliber measurements in different areas of the scalp to see if it supports our gut feeling in terms of a diagnosis. And obviously, if there's something inflammatory going on, we might do a biopsy to figure something out. Um, the pattern of hair loss makes a big difference. Of course, we know male and female pattern hair loss looks differently, but if you've got patchy hair loss or a huge bout of shedding, that's different than just a slight loss of coverage and receding of the hairline. So, that's kind of how we get things started. And we can do, everything from genetic analysis to see what metabolic pathways are
Yeah.
dysregulated, to blood work to find out what's going on metabolically, to look at biomarkers and things like that. So, that's just the beginning of what we do with a consultation here at Bauman Medical.
Right. There's so many causes for hair loss, and it's so important to look at so many different factors, that may be contributing, because if everything isn't, in favor of hair growth, even if you're doing, medical therapy or you're doing some of these procedures, you could miss a big part of, the support for hair growth.
Oh,
So when you do
absolutely.
blood work, is there like what are your top five sort of um uh, or blood work that you look at? Is there specific hormones, or tell us a little bit about your.
Well, of course, again, the medical history and symptomatology is going to start our journey in terms of what tests we might consider ordering, especially in a female patient who is experiencing perimenopause or menopause symptoms. We want to look at hormone levels. We want ferritin and vitamin D and iron levels and so forth are really, really important. I want to find out, what's going on with their sleep wake cycle. Are they on a special diet? Are they trying to lose some weight and or recently, converted to veganism or something like that? And all of a sudden their protein intake is dropping drastically. So, it's really tailored to each individual patient. I don't say a shotgun approach is the right approach for anyone in medicine. So, we might look at, again, the blood biomarkers. It's a more deeper dive into hormones. We may do saliva testing. And as I mentioned previously, DNA testing is something that's relatively new to the world of hair loss to look at, now we've got, well over, I think it's 2 dozen SNPs that are related to hair loss and metabolic pathways that influence what treatments you might be responding to or might more likely to respond to.
So tell me about that. Tell me about the saliva and the DNA testing. What is that? What are those markers, and what do they tell you?
Yeah. So, what's interesting, like over the years, obviously, being in the field for a long time and having FDA approved medications like minoxidil, right, topical Rogaine, was the first FDA approved drug. But what was interesting is that so many people had problems with over the counter Rogaine, even though it does work. Minoxidil is a very potent hair growth stimulator. Like 30 to 40% of people didn't respond well. And that's not including the others that like
Mm.
just literally couldn't do it because of irritation or hairstyling issues or other things. So one of the main markers that we look at in the DNA test is sulfotransferase activity. And folks can be they can have a propensity for a high or normal sulfotransferase activity, or they could be low in sulfotransferase activity. And the reason why that's important is because the minoxidil that comes out of the bottle is not the minoxidil that activates the follicle under the skin. Your body has to convert it to minoxidil sulfate, the active metabolite. And it does that through the sulfotransferase enzyme. So let's just say we
Mm.
do a DNA test and you are low in
Mm.
sulfotransferase activity. Well, that tells us a very likely reason why, if you try Rogaine or a typical topical, as I say, over the counter minoxidil, maybe you didn't get such a great result. And there's some ways around it, which is good news. Today we have boosters
Ah.
like tretinoin and things like that. We can do oral plus topical versions. We can add other therapies into the mix and the regimen. But that's
Mm-hmm.
just one of many biologic pathways, metabolic pathways that we look at. Other things could be collagen instability, 5-alpha reductase, type 1 and type 2, which is what creates DHT from testosterone. We also look at ACE, which is angiotensin converting enzyme, which tells us how your circulation is
Mm-hmm.
likely to be doing as you age, whether you have a propensity for vasoconstriction or not. And so you can get a sense, like by looking at these DNA tests, it'll tell us what kind of therapy is suited for you. And that's what I would like to call personalized precision medicine in its most purest form. Because
Yeah, and you lose
if
so much of
every,
that with these, with these online sort of businessmen that are just popping up with all these online, standard generic formulas for all. People don't realize that uh, it takes a lot of customized treatment to really get good results.
Well, then they get disenchanted and they get disheartened that, oh, it didn't work for me, or it's snake oil or whatever. Let's try to first confirm the diagnosis. Let's look at some risk factors. How are you treating your scalp? How are you treating your hair? How are you treating your body and your mind? So all of that plays a role, stress included, right? And then let's look at your DNA before we just, grab a bottle of Rogaine at the supermarket and wonder why, after unfortunately usually too short of a period of time, it didn't work for you, right? So there's so many more custom compounded
Yeah.
interventions that we can take today. There's regenerative medicine. There's new growth factors and peptides. There's things that are much more sophisticated than the traditional test tube PRP that's out there. And way in advance of we're doing a heroic hair restoration or hair transplant procedure, there's a lot we can do.
Yeah, and you bring up a good point because a lot of patients will come in and say, I tried this, this medication for hair loss, and I've been taking it for a month, and I still don't have my hair back. So walk us through about why that is, an unfair statement, and let's
Sure.
talk a little bit
Oh my
about
gosh.
hair biology and the hair cycle, and how long you should expect to, be consistent with your hair regimen until you see results.
Yeah. So hair follicles are like little 3D printers, right? And you're born with about 150,000 of them on your scalp, typically, plus or minus a little bit. And they produce hair fiber when they're in the on position, which means that they're in the growing phase called anagen. They produce hair at about a rate of about a
Mhm.
third of a millimeter a day, which is about somewhere between a quarter and a half an inch a month. So even if you had a hair transplant today, you're not going to see anything that's visible to the naked eye in terms of regrowth until you get to 4 to 6 months out. And medical therapies often take much longer.
Mhm.
And that's why, first of all, a month of treatment is like 2 days at the gym. And how come I didn't lose 10 pounds? I mean, come on, let's be real. So you
That's
definitely
right.
need to be on
Mhm.
treatment for months, not weeks, to determine what's going on. And even at a
Mhm.
microscopic level, measuring the scalp with a trichometer, the earliest follow up we typically make is 90 days. It takes a little bit of time to get you the medications and obviously get used
Mhm.
to those
Mhm.
treatments, get consistent with them. So 90 days is not the end of the story. It's just your first chapter in the hair restoration journey. And you're going to see, hopefully, we see nice changes in the hair measurements, and that will continue your motivation to obviously, adhere to the regimen and the program that we've prescribed. And then in the next 6 months, that's when you're going to really see the action. So, seeing results from any hair growth treatment, I would recommend the math changes first, right? The measurements, and then later visually the volume and the coverage and so forth. And it could take you a good 9 to 12 months just to see how that treatment works for you. And but I
Yes, I
remember
tell
you got
patients a year.
yeah, it could take a long, long time. Even in some patients with curly hair, even a transplant could take 18 months to show itself completely in terms of what we expect to see. So, yeah, don't most patients shortchange themselves with the regimen, especially if they don't have guidance, they don't have tracking measurements, they don't have a correct diagnosis, they're shooting from the hip, and then they wonder why it's not working. So, yeah, I mean, I get on my soapbox about that all the time. Find an expert, find a professional, find someone that you can call, click, or visit,
Right.
please, hopefully visit to get some in person measurements to know what's working
Yeah.
and where it's working. Because you might have an area in your scalp.
That's right. Yeah, I
Yeah.
always kinda chuckle when people say, "Well, I've been taking these hair vitamins for a few weeks, and my hair's just growing like crazy." I'm like, "Oh my goodness, like, how is that possible?" So, I think
Yeah.
in today's world, with Amazon Prime and this, instant gratification of
Yeah.
having everything you want within a two-day period, our expectations are a bit skewed. So, again, I tell patients the same thing. It's going to take at least 3 to 6 months, but really, you got to stay consistent for at least a year with your treatment to be able to really see anything. So, in a recent video, you said hair transplant is 90% art. And it really seems like you have this passion for doing hair transplants. It is a world that I know nothing about. Even as a dermatologist, I've never done a hair transplant. I don't do them. Can you tell us a little bit more about at what point do you say, okay, we've given medical therapy a chance. I think, you would benefit now even more from a hair transplant. And I want to really get into hair transplants or talking about it.
Sure. Sure. Well, sometimes we know right away. A patient comes in and they have a scar, from a plastic surgery procedure or injury or other trauma, and the follicles are not coming back,
Mhm.
not on their own. So, if you have an area that's severely depleted of hair follicles, you're going to need a transplant to cover that. And in other cases, we might find, let's say, a woman has been treated with hormone optimization therapy, which includes testosterone, and her doctor forgot to mention that hair loss can be a side effect from testosterone therapy, and she has now a deep receding hairline from the testosterone creams or pellets or something. Very oftentimes we find that yes, medical therapy will help slow down and restore some of the hair growth, but some of the follicles are too far gone. And we
Mhm.
say that these medical therapies, are not going to bring the dead back to life, so to speak. So, very
Mhm.
often in the early phases, we might be thinking, well, you might need a hair transplant for this. And especially in men, of course, where the baldness has happened and there's really no hair follicles left that are doing anything in any way, shape, or form that could be rejuvenated. They're going to need some degree of transplantation. And so, hair transplant is an art. And I said that on the air for the first time when I was featured on CNN back in 2001. So that was a long time ago when I first said that comment. But
Mhm.
I still believe that today, even more so, because we have unique control over each and every hair follicle that we transplant. And what I mean by that is it's not just the hairline shape and design that needs to be fine tuned to the man or the woman and their age, but then the angle, the orientation, and the position of each transplanted follicle makes a difference in terms of what kind of coverage you're going to get and how natural it's going to look. So the choice of single hairs into the hairline, single hair
Mhm.
follicle grafts versus larger pluggy groupings that were done, many, many years ago, or the straight across hairline that we see from many of these, you know, tourist attraction, medical tourism destinations in third world or developing countries where they don't have any artistry whatsoever. They just draw a straight line with a laser across your head. I mean, no one in the world has a hairline like that unless it's been transplanted. So if you see somebody with a straight across hairline above their eyebrows, you kind of know what's going on there. So the point is, we create something that frames the face artistically, fine tuned to each individual patient and their anatomy. The left and the right side might not be identical. And so we need to fine tune the hairline to flaunt the features and to create the symmetry and to restore the hairline
Mhm.
to a youthful place. But, if you're 50 or 60 years old as a male, you don't need a teenager hairline. That's not going to look good on you. And so, it's really, really important for men or for women. And a lot of, honestly, a lot
Mm.
of hair
It's a
transplant
good
surgeon
point.
colleagues of mine who are amazing at what they do, they typically don't treat a lot of female patients as we do. We have nearly 50% of my patients are women. Uh, and so we have a lot of unique experience. I have a lot of unique experience designing the hairline so it frames the face appropriately and
Mhm.
turns the clock back for those women. Even if we have to recreate the hairline in a woman who has born with a high hairline, that's a specialty procedure. Um, and smaller areas like eyebrows, for example, very delicate area. Every single hair follicle has to be perfectly
Mhm.
um, adjusted and tuned essentially to get the result that you want.
Where do you take the hair when you do eyebrow transplants? You take it
So
from the
traditionally,
scalp or
yeah, traditionally eyebrow transplants are from the scalp, and so they do grow a little bit faster than your traditional eyebrows would, and they do need to be trimmed. Therefore, once or twice a month at least, sometimes more.
Mhm.
But for women who have lost their eyebrows through over plucking, or because years ago the thin, wafy brow was the thing, and then now I would say
That's
it's
right,
more
yeah.
Kardashian-esque, for lack of a better way to explain. Needs to be thicker and taller and more defined and more prominent and more dense than ever before. So you are often asked to replace eyebrows in women of all ages who have undergone trauma or have had hormone imbalance that have destroyed the eyebrows permanently. So yeah, eyebrow transplantation, very delicate procedure that does take it takes long, it takes many hours to complete an eyebrow.
Do do they do eyelash
I
transplants? I'm
do.
just curious.
Absolutely.
You
So
do?
I've been
Wow.
doing eyelash transplants since 1999. My eyelash transplant mentor was a very famous plastic surgeon from Sao Paulo, Brazil. And he taught me a very interesting technique that enabled me to basically, it's almost like a sewing technique that places the follicle in the lid at the appropriate location, exit at the lash line, and angling the curl correctly is where the rubber meets the road on that type of procedure. And
So where do you get the eyelash from?
so typically, eyelash transplants are taken from the scalp. That's where I like to go. There are surgeons that use other locations, let's say below the belt, to keep it G-rated for eyelash transplantation. Although the insertion technique that I just described is what I consider the safest process, and it does require a long hair. So I would prefer to use the scalp hair. Even in Asian patients who have relatively coarse and straight hair, we certainly use the scalp hair for that. And eyelash transplants also come with scissors. You're going to need to trim them and groom them and curl them for sure. If you have straight hair, you might not, you might even have to perm them.
No, yeah, that's what I was thinking because they're, just the quality of the hair is so different.
Mhm.
I'm surprised by that. I didn't know that, that actually could be done. Is it pretty successful? Does it have a higher success rate or about the same as hair
So
transplants or?
yeah, I mean, when we transplant follicles on the scalp, we have a 99% growth rate. That has to do with some of the nuances regarding to the way that we harvest the hairs, the way that we store the follicles outside the body while they're awaiting implantation, and the tools and techniques that we use for implantation, as well as our postoperative recovery, healing, accelerator treatments. So we have a very, very high rate take rate. Um, Eyelash transplant can be trickier, so we say about 95% in terms of the growth rates. It does take the same amount of time to grow a hair in the eyelid as it would on the scalp. So be looking out for hair growth starting at 4 to 5 months, half of the result at 6 months, and the full result in a year.
Nice, nice. I love that. So, in terms of hair transplants, are you seeing, more men than women, I would assume, or do you see a large number of women go in? Because I don't think it's something that women really think about, like you said, unless it's like a scar that's not growing hair or, certain circumstances.
Yeah. Well, back
But
over,
yeah, so,
yeah, I would say, 25 years ago, my practice saw mostly men. It was probably like 90-10 hair transplants, male versus female. But today in the practice, it's 50-50 through the door. And as I said
oh,
previously,
wow.
nearly half of all hair transplants we do are on female patients. So, but remember that that also does include eyelash and eyebrow transplants, plastic surgery, scars. And more patients I find today, female patients, are good candidates for hair transplantation. Many, many more today than, let's say, back in my earlier parts of the career where the instruments were a little bit larger, the techniques were not so refined. Whereas today we have techniques that enable us to get in between existing hairs safely without damaging them, without trimming the existing hair, actually. And that's an unusual thing today. A lot of times you'll see hair transplants online and the people have a completely shaved head. Well, obviously, our female patients wouldn't really like that. So we've developed
Mm,
techniques over these years to not have to
yeah.
shave your head to do the transplant. And so I think the word spread very quickly. Within the
Yeah,
first,
yeah,
7 years, 10 years of my practice, we started to notice more and more and more women coming into the practice and wanting hair transplants, needing hair transplants, and became more better candidates for transplants than ever before. But certainly, we don't start out that way with our female or male patients. We want to start out with the
yeah.
preventative therapies. So many
Sure.
women will start with other things too.
So who's a good candidate who's a good male or female, a good candidate for hair transplant? When would you say, okay, I think I'm gonna do that now?
So, when a man comes into the practice and we're evaluating his situation, we want to understand what he's seeing and make sure that comports with what I'm looking at from across the room. Um, I mean, what taught me that very early on is that, I had a patient come in, he was totally bald, and originally I assumed that he wanted a full-blown heroic hair transplant, and actually he had a little scar on his eyebrow that he wanted fixed. So, listening to patients is an early lesson, right, from 25 years ago. But the point is that if the follicles are truly dead and gone, and that's an area of concern, for a man, it's a receding hairline and it's gone back, or he's developing some baldness in the crown. First thing we talk about, especially if he's a younger patient, is let's protect the existing hair. So the medications and the lasers and PRP and nutritional supplementation and that other, lifestyle approach to his hair loss is also really important. But if he's motivated to densify the hairline or to readjust the hairline into a more youthful position, and he's not expecting something that he's going to get turned back into a teenager hairline, then he becomes an appropriate candidate for a procedure. Or if there's an area, let's say in the crown, that he wants to cover, we can transplant that. So that's how we would proceed, right? Prevention, first and foremost. We spend a lot of time talking about that, making sure he's stabilized on medical treatments, especially if he's a young patient, demonstrate some discipline and compliance, adherence to the program to protect his existing hair. Then, if he's still doing all of that, then he can become a candidate for transplants. On a female side of things, similar idea. Typically, our female patients are a little bit older. They range, more of my female patients are in their 50s, 50s to 60s. But hair loss can occur, obviously, even with PCOS in women in their 20s during the years of childbearing age. And so, but many women come in and they have more of a diffuse thinning problem, and they need non-invasive therapies. So that's where we're going to leverage our regenerative medicine techniques, treatments like PRP or TED or PDO or even exosome therapy. We're going to prescribe laser light devices or medications like minoxidil and so forth, as well as look at their lifestyle and taking a functional medicine approach to their hormone situation. But again, as we mentioned before, if they're starting to recede and the density in those areas under the microscope is very, very low, or they've been on therapy and they haven't gotten a great response there, then it's time to talk about transplantation.
Wow, that was really great. We have the most amazing podcast community, and we want to thank you for being such a loyal listener. To thank you for being a fan of the show, we want to extend a 15% offer exclusively to podcast listeners. Use code April15, APRIL15 at Aussie MD Skincare, April 15 for 15% off. This is a special discount code we're only giving to our podcast listeners. Don't forget to tag me in your skincare selfies. I love to see you glow. Now, we always talk about preserving the follicle because, like you said, once those follicles are gone, you cannot bring them back. Is there a window of time where you got to get on the ball, or at what point do you say it's too late, and how can you make sure you catch those follicles as their miniaturization is happening?
Yeah. So sometimes the first signs of hair loss could be just excessive shedding. And you may know, like through your family, biologic relatives, like sister, brother, or, mom or dad, or grandparents, or great grandparents, that there's some hair loss in the family. We want to be on top of that as soon as possible. So I always recommend come in and get a measurement because there's no time to waste. Time is follicles. If you're really going to experience hair loss, it's
Hmm.
a chronic and progressive condition over time. It gets worse without treatment. And you can lose 50% of your hair without it being noticeable to the naked eye. And it might sound crazy, but that's how the density math works. I mean, I have, 40%,
Right.
nearly 40% loss in my crown area. And you wouldn't know it by just looking at me from across the room. My dad was completely bald. I'm high risk. My mom's dad also had hair loss, almost completely bald. And so, I've been paranoid about that for a long time. And so fighting hard at the earliest possible stage is what's required. But how would you know? You have to get measured. And so that measurement is the
Hmm.
critical step. And then if you're on treatment, how well is that treatment working? You need to get the measurements at a repeat visit at an appropriate amount of time. Maybe it's once or twice a year to know what's happening at the level of the scalp. Is your treatment really truly preserving what you have? But there's other signs and symptoms too. If there's a change in your hair texture or color, if something's happening where it looks like you have more breakage than normal. Sometimes breakage is truly a break, like it literally snaps from
Hmm.
over processing. And sometimes breakage is just a lot of miniaturized hair, meaning that the cycle is breaking before it completes. And so if that's what's happening, that's when
Right.
you deserve to have someone with expertise to look at it.
Yeah, it's not just, hair thinning, but it could just be that your hair is not growing as long as it used to because it's not staying in the growing cycle as long. And so I think that's a really good point. It may not be breakage, it may actually just be miniaturization of the hair.
Yeah, shortening of the growth cycle is so
Yes,
critical
yes,
to identify that. And, that's not something that you're going to have a checkbox on an online form.
that's right.
You need to actually have someone looking at your hair and holding it up in a ponytail and seeing what's happening. Look for that minute, combing it to the side, using a high powered microscope to look at hair caliber and length.
Yeah, there's definitely a lot of signs that give us clues as to what's
100%.
happening. I want to get into regenerative medicine before I let you go in terms of, exosomes, red light therapy. You mentioned PDO. I'm assuming you meant PDO threads.
Absolutely.
Is that, did I hear that right?
Yes.
Well, let's start with PDO threads because I've heard this. I thought it was a rumor. but does it actually help with regeneration, and how does that work?
Yeah, so I learned about PDO threads through an aesthetic colleague of mine while I was overseas at a medical conference in cosmetic dermatology. Now, I'm not a dermatologist, as you know. I'm trained in surgery and fellowship trained in hair transplants, and that's all I've done. But this person said to me, "Hey, did you ever try?" This is many years ago, 9 years ago. Did you ever try PDO threads in the scalp? I'm like, I don't know. I don't think that's going to really work for hair growth. And he's like, well, there's some research out there in the Far East that kind of supports it. They put some threads to do some, tensioning and tightening of the skin, and where they were placed under the hair bearing areas, the hair seemed to improve a bit. And so there's some folks in South Korea and India kind of doing this kind of work. And I tried it basically, and with some encouragement. And of course, we got like, family and friends in the trial.
The guinea pigs, we're always our
Yeah, the
own guinea
family and
pigs.
friends. So the interesting thing about that process is that we didn't use anything else but threads into the scalp. Of course, we did it under local anesthesia. I had some guidance from the clinical literature, which was out there, a couple of case reports, and someone who was proficient in threads for the face to help me determine the length and the size and types of threads.
So are we talking like 20, 25 gauge, 29 gauge, 18 gauge? What level of
Yeah, so
threads
these are
are
29
you talking
gauge,
about here?
and they could be,
Mm,
basically 3 centimeters or less, depending on what you choose. And we put literally hundreds of them sometimes into the scalp. But the point was is that we did this pilot study, and the first dozen patients, and
hundreds.
we tried men, we tried women, we did the frontal hairline, we did the temples, we did the crown. Every single patient we tried it on had improvements mathematically in the measurements and visual changes on the photos, and I was blown away. I couldn't even believe it. And the interesting
Mm,
thing that happened after that is that I was supposed to demonstrate this technique and present the clinical trial results at another cosmetic dermatology conference in Miami. And I was supposed to have two separate patients. I was going to demonstrate our PRP techniques, which were great. And I had another patient that was lined up to show the PDO treatments. And it ended up one of the patients didn't show last minute. So we ended up doing PRP plus PDO threads on one patient. And it was the first time that we had ever done that. It was, of course, live on stage. Um, but that patient had twice the
mhm.
result of any of the other patients that we had ever seen. And so that's how we got started with the treatment that we now call
Ah,
PDO Grow, GRO. So PDO Grow is my process for preparation and deployment of a high
mm.
quality, high density
Wow.
PRP, at the same time placing PDO threads into the scalp. And so that's something that we teach and train physicians how to do. We certify them. We like to use the PDO Grow threads. Those are the ones that are fine tuned specifically for the scalp. And it's been an exciting journey. And it's been many, many years. I've presented on that technology across the world, conferences like IMCAS in Paris, and also the International Society of Hair Restoration Surgery, Cell Surgical Network, and things like that. So, or Cell Surgical Conference. We presented many, many times on PDO and PRP as a combination therapy, and those original pilot studies, which were
Yeah.
still pretty cool to see.
Yeah, so it sort of makes sense, the threads stimulate collagen. Do they also stimulate, the hair follicles to sort of wake up? And is that the mechanism, or
So, yeah,
what other
we don't know exactly, but there's certainly some evidence in the clinical literature. I actually did a deep dive in the literature, and someone had tried PDO threads on the backs of mice, and they found biomarkers for increased anogen and decreased telogen. And of course, anogen being the hair growth phase and telogen being the resting phase. So producing hair growth on these mice that were in the laboratory after insertion of PDO threads. And but the follicles need to be there. If the follicles are dead and gone, again, this is just another tool in the toolbox for regeneration. Again, every little detail of the regenerative process is not worked out, but there's a huge release of growth factors in the scalp. There's not a lot of tissue reaction, which is great. If you know anything about polydioxanone, that's the material that was used as a deep suture material in surgery from like 40 years ago. It was a purple thread, and it lasts for months and months in the skin. So it slowly dissolves over time without a great tissue
Mhm.
reaction, but you get this boatload of release of growth factors from the body. And we think that's what's stimulating the hair growth. So
Mm.
just like an extracellular matrix that you would use in combination with PRP that could be biologic, like either placental tissue or Wharton's jelly or some other perinatal tissue, this is a synthetic extracellular matrix that seems to potentiate the effects of the regenerative capacity of a well-made PRP.
Oh, how interesting. I love
Yeah.
that. So exosomes are very hot right now. Everyone's talking about them. It's the holy grail of youth and so forth. And they are being used for hair growth. My understanding is the FDA has not approved any exosomes for injection therapy, at least in the United States. This is kind of what the guidelines are. Are you using exosomes in your practice, and how are you using them?
So I've been a huge fan of exosome therapy for a number of years. Even before the FDA put out its guidelines back in 2017, we knew this was coming of age because I've seen what's going on at the World Stem Cell Summit and things like that, where exosomes were being used as a diagnostic tool, liquid biopsies for cancer, so forth, as well
Hmm.
as a regenerative treatment in the field of orthobiologics. So very excited about cell lines that produce cell signals that are then captured because we've done stem
Hmm.
cell therapy in the practice where we've done an lipoaspirate and converted that. As you probably well know, before the FDA changed its regulations or gave out a guidance document, which by the way is not law, but it's a guidance document. And so we did much of that with some very good
Hmm.
results for hair regrowth. But it's nice to be able to have something that contains those same growth factors and chemical messages, essentially biologic messages that stem cells would produce without having to go after the cells and do some surgical procedure. So in the practice, yes, we apply them topically. We apply
Sure.
them at the level of the scalp. One of the ways that we found works very, very well with exosomes is a treatment called TED, transepidermal delivery. And so TED uses ultrasound. It's a sonophoresis tool
Yep.
that has its own growth factor serum, which is phenomenal, by the way, for hair regrowth. But if you want to add a little juice to that mix, exosomes can be pushed through the skin without an injection using TED.
Mhm, mhm,
So it's a real nice way to get your
mhm,
exosomes deep down into the
mhm.
skin where you need them to do their business without having to do the injection, and you can be in compliance with the FDA guidelines.
Right, and similar to what we do in our practice, laser-assisted drug delivery, which then you can use exosomes because when the skin is open, they can get to where they need to go.
Absolutely.
So, in terms of red light therapy, I think you touched on that a little bit. Is that you know I've looked at the studies and there is some evidence. I would say 10% maybe regrowth of using just red light on its own. Is that something you found to be helpful as well?
Absolutely. Slay on the red light. We're going to use red light all the time. Now, back in 1999, I got my first red light device in the office. It was a 60 diode laser at 670 nanometer wavelength. The thing was as huge as a hair dryer from a salon and
Yeah.
weighed 3 times the amount. I mean, it was a massive device. It made all kinds of noise, came down over the scalp like a big helmet, and rotated around, bump, 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 made all kinds of crazy noises and movements. But anyway, the point was is that I was a big skeptic back in the 1990s about low level laser therapy, and I actually tried to disprove laser therapy as a treatment option for hair growth. But what we noted back then is that patient after patient after patient who went under that treatment, who were consistent with the therapy, were getting improvements in their hair quality, hair thickness, hair length. Everything was improved. Even hair color was improving with laser therapy. And so I've been a huge advocate. And of course, we didn't know back then how it works, but today we know. Red light gets converted into cellular energy at the level of the mitochondria. The cytochrome C oxidase is the photoacceptor molecule. Dr. Michael Hamblin taught me that. He's Harvard MIT guy, who
Oh,
was
I worked with Dr. Hamblin at Wellman
Wellman Center for Photomedicine.
Photo
Yeah.
Medicine.
Well,
Oh, that's so funny how you know him
yeah.
as
So
well.
I was in his.
I did a research fellowship with
That
him.
is awesome. So I was in his back cave, which was just like filled with
Uh,
periodicals and journals up to from floor to
yes.
ceiling. And I have an amazing picture that I
Uh,
show my wife whenever
mhm.
she says my desk is too messy. And so, but Dr. Hamblin is the hero of low level laser light therapy and photobiomodulation because he is the most prolifically published researcher on the planet when it comes to these
Mhm.
modalities. And so
Mhm.
he's the one that taught me how red light therapy works and other wavelengths, by the way, for decreasing inflammation and so forth. And we have the turbo laser cap is the Bauman turbo laser cap. That's the premier laser device that's on the market. It has the most number of diodes. It has 25% more coverage than any other device and has the shortest treatment time. And it's a 5-minute device. And so that's very different than the consumer laser devices that you might see out there on Amazon today, which, It's kind of a new phenomenon, but that's what it is. If
Sure.
you're looking at lasers that are, in the, $600 to $2,000 range, that is the low end of laser light therapy. The top end high quality devices are going to be in the $3,000 to $5,000 category, and that's where the Bauman Turbo laser cap really wins the deal in terms of compliance. It packs completely flat actually for travel, which is nice too.
So tell us a little bit about how often would one, sit under this cap or wear the cap
So the turbo
or
laser cap
go
is,
into your office with the cap? Is that
yeah, you don't
is
even,
it an in-office treatment?
well, we do have lasers in the office because we use red light therapy before and after hair transplants, PRP, PDO, exosome therapy, and even TED. And any scalp treatment that we're doing for inflammation, we'll treat patients with photobiomodulation. But the best thing about the turbo laser cap is you could do it at home.
Mm.
So it packs completely flat for travel. You can take it on in a backpack, put it in the outside of your luggage and whatnot. It has a battery pack powered device, so it has a rechargeable battery pack with it. So it's just 5 minutes at night before bed. You just pop it on and set it and forget it. There's no side effects with laser light therapy. It's a non-drug treatment option. And of course, you don't have to go far today to find out about all the amazing benefits of red light therapy. You don't have to go to visit Dr. Michael Hamblin, but if you get a chance, you can certainly he'll give you the whole lecture and spiel on how it works.
Well, I'm gonna check it out. I love that. So just 5 minutes every night. And what's nice about it is you don't have to do anything with your hands. I've seen those laser combs, where you have to sit and, back, I think maybe it was 15, 20 years ago. That's what was available before these, fancy caps came through.
So
Uh,
true, so
so,
true. So, Dr. Michael Rabin, another Michael, he invented the original laser cap in Cleveland, Ohio. So, American made. It's been knocked off a gazillion times, mostly by the Chinese and others. But that's who we worked with to reimagine, re-engineer, and redesign the Bauman Turbo laser cap. So, we've got and Dr. Hamblin is on his advisory board and is part of the engineering group that guided him for the development of that device.
okay, but before I let you go, I love to play a game with my guests. It's called Slay or Nay. Slay
Yep.
being you love it, and nay being you'd rather just be
Okay.
without it. So you ready?
I'm ready. Hit me.
Okay. So first one is ketoconazole shampoo for hair growth.
So ketoconazole is an antifungal shampoo. It works great to knock out the fungus. It also has a mild anti-androgen property to it, but the downside is, I guess this is a long answer to slay or nay, huh? The
That's fine.
downside is
That's
that
good.
ketoconazole shampoo is just nasty on your hair and scalp. I mean, it turns your hair into a ball of hay. I mean, it's terrible. So
Mhm.
for most people, cosmetically inappropriate, unless they have a severe scalp problem, overgrowth of their microbiome, the fungus. And so I would recommend a visit to a trichologist before using a ketoconazole shampoo. There are plenty of other shampoos. So I'll have to say I'm leaning more towards the nay unless you're specifically prescribed that.
And what about like Head and Shoulders? Is that a better option for them?
So Head and Shoulders is geared towards people with quote unquote dandruff. But again, what's the cause of the dandruff situation? Is it dry dandruff? Is it moist dandruff? Is it oily? Is it yellow, big yellow flakes? Is it small white ones? This is important to know because seborrheic dermatitis is going to be treated treated differently than dehydration. Head and Shoulders is a nice quality shampoo these days. So 10 or 20 years ago, or even longer, Head and Shoulders was not so cosmetically friendly. But I think the P&G folks really fine tuned that protocol, and they also did a lot of science on the parathione zinc. I happened to be on the Pantene Medical Advisory Board a number of years ago, and the data was very, very clear that parathione zinc does knock out some of that malassezia, which is the fungus that can trigger dandruff and such. So, but the thing is, Head and Shoulders shampoo is the most popular shampoo in the world. I forget how many thousands of bottles they sell every minute, but and that just goes to tell you that a lot of people have scalp
Wow.
problems. And I'm very, very keen on trichology, which is a study of the health of the scalp and the hair follicle. And we have an entire department at Bauman Medical that's geared towards the health of the scalp. So if you have a scalp symptom, you got to get it evaluated by a certified trichologist or board certified hair restoration physician before you just grab a bottle of Head and Shoulders. I think that would be my best advice. But Head and Shoulders feels good
Mhm.
and it cleans the scalp. So, you know, slay.
Well, I didn't know it was that popular until you
It's the most popular shampoo. Yeah,
wow.
because everybody's got a scalp problem. Everybody's itching.
What about taking over-the-counter hair supplements like Nutrafol or, Hairtamin is a popular one. What are your thoughts on that?
Well, I'm very picky. I do like Nutrafol, and of course, we have our own Bauman brand, the Bauman MD Nutra System for hair. And the bottom line is that Nutrafol is one of the few supplements out there in the market today that actually has peer-reviewed science behind it. So they launched that product through physicians, and I applaud them for doing that, getting our feedback and testing it and trying it on our patients and so forth. Um, but again, if you're just reaching for this magic vitamin and you don't know what your diagnosis is or how severe your hair loss is or how quickly it's progressing, then you're going down the wrong path quickly. I do like Nutrafol, so I'm a big advocate. But again, don't try to self-diagnose these things, and tracking hair loss on your own can be difficult. So again, get with your hair doctor and do some measurements so you know what your hair loss status is and how it's progressing over time.
Dutasteride scalp injections.
Dutasteride mesotherapy. Yeah, that's a great topic. I'm a big fan of dutasteride. It's a much stronger anti-androgen than the finasteride. It works by blocking the type 1 as well as the type 2 5-alpha reductase. The clinical literature, most of it coming out of Europe, has been excellent in terms of results. We're a little bit behind here in the United States on research in the world of dutasteride mesotherapy because it took so much longer for us to get product. I don't know why, but now we do have
Hmm.
compounders that will make the dutasteride for us, sterile for injection. um, it's got to be deployed properly into the scalp. And so I would just recommend, if you're looking into that therapy, it's not a first line treatment. So again, your hair loss physician, hair restoration physician is going to probably use the regular treatments for you first. And if you've reached a plateau, you can certainly try the dutasteride mesotherapy. But the deployment of that is really important. So the quality of the dutasteride, making sure that it's not out of date because there's a certain limited time that it's going to be viable there in the sterile injectable, and then making sure it's deployed properly into the scalp and with no pain. So if you're getting a painless injection, that's great. If you're getting a painful injection on the scalp, like PRP or a painful mesotherapy treatment or anything painful, gosh, that's not good because the pain is causing stress, and stress is not good for hair. So don't do that. Yeah,
Yeah, that
if
is
you're if you're
true.
getting if you're
That
getting
is
hurt from
true.
PRP, then your provider is not doing it properly.
Yeah, yeah, I love that. Well, this was so valuable. I learned so much from you. Thank you so much for joining us. Tell everybody where they can find you online. Your institute is the Bauman Hair Institute you mentioned. Yeah, so give us a little bit more
Well,
info.
Dr. Ozzy, it's really a pleasure to be here talking to you about hair loss and hair restoration and helping your followers and maybe even the ones that they love and know, friends or family, with their hair loss situation. Maybe we get some questions from the podcast and we can come back at a later date and answer those either with another podcast or even IG Live or something like that. So we'd love to collaborate with you and any questions that come up from this discussion that we had today.
Yeah.
But Bauman Medical Hair Transplant and Hair Loss Treatment Center is located in Boca Raton, Florida, which is not a bad place to visit. But nearly 50% of our patients connect with us through the website first. So
Hmm.
BaumanMedical.com is the main location with thousands of pages of information, of articles, hundreds of hours of videos that we've recorded either from the news or educationally for our patients to go and learn about hair loss and hair restoration, as well as all the so many photos of before and afters and the different technologies that we use related to hair loss and hair restoration. So BaumanMedical.com, you can go to, even if you have just a simple question, you go to BaumanMedical.com/ask, and you can just type in a quick question and my team and I'll get right back to you with the answer if we know it. If we don't know it, we're going to research it. And so that's even more fun. But many patients start their hair
Right.
restoration journey through a virtual consultation. So just like we're together from a distance on Zoom from Florida to California,
Hmm.
we could be speaking to someone virtually from anywhere in the world from their home or phone through a virtual consultation. You can request that at BaumanMedical.com. And of course, people can find me on all the social media channels and DM me at any time. And I will promise I do respond to every DM, whether it's, LinkedIn or social media like Instagram, Facebook, Twitter, you name it.
I love it. Well, thank you so much. Can't wait to reconnect again. And it's so good to know somebody who's a hair expert because, like I said, I don't know a lot of hair transplant docs. So it's been really great connecting with you.
Well, great to be with you too. Thank you so much.
Okay. Thank you. Have a good rest of your day. Take care.
You too as well.